we all know that charging our phones is a necessity every night. Do you ever go to sleep without charging your phone?
And if I do, I have 2 battery packs on me at all times ready to go.
Right?
Yeah.
There you go. Like, we're so in tune with like making sure our computers are charged, our phones are charged, but it's secondary to think that our brain computer needs to charge. Welcome to the Alfi Podcast, episode 20, with my good friend and business coach, Antonio, here in South Florida.
David, what are we doing here in Florida? There's no Kobe background. This is a different setup.
Yeah, we got the AOS logo back here.
Let's do it.
A little different vibe.
Yeah.
But, we come off in the Miami area to see patients.
David, I'm convinced you're here in Florida more than you're here in Texas.
Try it, yeah. It'd be nice. I love the beach.
Yeah.
We had a great day today. Saw a lot of consults, excellent patients, good candidates for surgery. It was a really nice day. And then we have a really exciting next couple of days with you guys.
Yeah. I think I want to talk more about that here in a few.
Okay.
Coming behind the scenes, but we'll talk about that in a few. But I'm curious, from Texas, you're also seeing clients here in Florida.
Right.
Why is that the case?
Yeah, so I grew up in LA, in Los Angeles area. Was there for the first 21 years of my life. Moved to New York and spent 10 years there. Trained at Columbia. Did all my school, postgraduate school in there. And then been in Houston for 13 years now. And I loved Los Angeles. I love New York. And Miami is my favorite city. And we have patients coming from all over the country, all over the world, but definitely all over the country, to Houston for consultations and surgeries. And I thought it would be really nice to meet the patients in these different cities and make a routine to visit. So we do LA, Miami, New York, and I see consultations there as patients come to Houston for surgery, and it's been a regular thing that we're doing, and it's awesome. It's
really
been
just
a routine now.
To broaden your reach, broaden your opportunity and
Right.
visit, and hey, this is what I do, and lure people back over to where you're currently headquartered in Texas.
Right.
But there's conversations of branching out.
We're just signed the LOI actually. This hasn't even been announced yet, but we're opening a branch in Miami in the Aventura area. Found a really nice space in Aventura in the medical center over there. So hopefully opening up fall 2025. Our current associate and fellow, Dr. AJ Salsinas, will be joining me there.
That's exciting.
Yeah.
So I'm curious. I'm going to go very deep right up the front.
Mm-hmm.
Why do you do what you do? It's not something that's easy where you can just sit back and, it's a normal average every day for you.
Right.
From what I know, you're going above and beyond and leading one of the top leaders in the industry, I like to say, or at least I think here. Why do you do what you do?
Yeah, it's. I feel very blessed that I feel like I never work a day in my life because I enjoy what I do, and I think that was always important to me. Early on, I never wanted to look at work as a job and wanted to do something that I would enjoy doing, like a hobby, and I know that I would be successful doing that. I went into medicine not with any mentors or pressure growing up trying to be in medicine. I'm Persian, and I don't know if you grew up with any Persian people, but
Italian.
Yeah. So Persian parents want their kids to be engineers, lawyers, or doctors. I didn't have any of that pressure. For me, it wasn't any of that. I really fell in love with studying the body, and when I went to dental school and medical school, I really, really enjoyed, like a nerd in a library, I really enjoyed sitting there and reading it and enjoying it, and I fell in love with surgery. When I became a surgeon after falling in love with jaw surgery, and the reason I fell in love with jaw surgery, it was because it was a functional and aesthetic benefit, and the transformations were instantaneous. Surgery is interesting in all aspects, but there are very few surgeries where you see visually an instant transformation like you do in orthognathic surgery or jaw surgery. And that was definitely the case that drew me into it. Since I've been doing these operations, my philosophy, knowledge base, experience completely has changed everything. I do it in a way that I didn't learn how to do it at all. I've developed the way that we do it, and now really seeing benefits of it that were not even fathomable. So, for example, when I was training, we were doing jaw surgeries really to correct underbites, overbites, asymmetries. So bad bites, not even bad bites, I'm going to say terrible bites that braces or an orthodontist couldn't fix and only can be fixed with surgery.
Wow.
Those are the patients we were treating. Now, the way we see the surgery is that, one, everybody could benefit from it because everybody has small jaws. And evolutionarily, or through times, what's happened is jaws have been shrinking, right? So if you look at skulls 100 years ago, 500 years ago, 5,000 years ago, they've been shrinking and they're continuing to shrink. And that's why, if you think about so many things that we've normalized, like, have you had your wisdom teeth removed?
All 4 of them surgically removed. They were growing in sideways.
Yeah. Have you had your wisdom teeth removed? Yeah. So I think 85% of Americans get their wisdom teeth removed. Extremely high percentage. And we've normalized these things without really even asking, why don't we have room for the teeth? And it's that simple. We don't have rooms for the teeth because our jaws have been shrinking over time for reasons. That's a whole other podcast. We could talk about reasons for that. They're definitely environmental. So what happens is that almost everybody, all people that have had their wisdom teeth out, for example, or all people that have crowded teeth, and again, 80 or 90% of the population has crowded teeth, and that's because they don't have room for their jaws, is that they also don't have room to breathe optimally. So just like wisdom teeth has been normalized, it's been normalized that people snore as they age and they develop sleep apnea. And then it's also normalized that these same people develop high blood pressure, eventually get heart attack, stroke, dementia, Alzheimer's. But all these things all can be tied down to the jaw size shrinking. So you brought up something here. So why you do what you do makes sense. It's not you're not working a day in your life. It's something that excites you, invigorates you. It's rewarding. It's fun. Transformation. You're making an impact. It makes sense for you. Got that. But you just shared as far as crowding teeth, no room for your tongue. It could be a conversation where over time the jaws are getting smaller. Right. For someone who is just watching this podcast or someone who hears this, they might say, what are we talking about? Yeah. You know, is it evolution? Do you believe in evolution? If the jaws are getting smaller, why is this all of a sudden happening now? How does someone go from, okay, normal surgeries that are just fixing what braces can't fix, right, to, yeah, this is something where everybody really needs this or could benefit from this? How does that happen? Yeah. So I do believe in evolution, but not in the Darwin sense. I do think that we're created. And this is obviously a whole other philosophical discussion. But there's no doubt that environmental pressures can make us evolve, right? We see that in bacteria and in lower models, and we see it in humans. But what happens is that, you know, if you go back in time before all this industrialization and agricultural phenomenon, people were hunters and gatherers, right? And they didn't have stationary homes with heaters and homes with mold, with allergens, and they didn't have a house with a cat in it, right? Times were different in early human or early times, ancient civilizations. So people had to hunt and gather foods and move around. So life was very different. Environments were very different. They had to chew harder foods. They didn't have time to put it in an oven. So things weren't in a crock pot. They were tougher to eat. So chewing was much more present, especially when in critical times as we're growing in development. Kids were chewing real hard foods, and that stimulates jaw growth. Other things that happened before is babies were dependent on breast milk. So mothers breastfed for longer periods of times. Nowadays, it's just not possible, right? At least in the U.S., but most parts of the world, both mothers and fathers, or women and men, are in the workforce, right?
Right.
So just logistically, because of modernization, mothers don't have the option to breastfeed. A lot of them don't, right? And even with that, if they do, it's very convenient to bottle feed. They didn't have formula milk back in the day. So really important early period things have changed, right? Where babies are not using their jaws like they were to get that milk. They're not chewing early in life to stimulate the jaw growth. Foods are processed, they're easier. And then that's a big part of it. There's other things too, like allergens make it difficult to breathe through your nose with mold, heated houses, pets, so many things that are new for modern societies that nasal breathing can be affected from these environments. Kids go to daycare because their parents are working, and what happens when kids are in daycare? They get sick often, and when you get sick, you get congestion. So there's so many things that stimulate mouth breathing because the jaws are small, the noses don't have room, and that also affects facial development. So you add up all these things, and it's happening at an accelerated rate now. The jaws are not growing to the potential. So we don't see people with straight teeth, 32 straight teeth in their mouth. They all need to get their wisdom teeth out. They all need to get into braces. Did you have braces?
No, but I can definitely use a pair.
Because you go use a pair.
My brother, he just got out of almost 2 full years of braces.
Right.
So why is that the case? If it's a smaller jaw, when babies are born, they have perfect teeth.
Yeah, very, very common sense. It's just, if you take a jaw that has to have a certain amount of teeth and that jaw is smaller, the teeth have no room to stand straight. It's too crowded. So, you have a small elevator and you put 10 people in it versus a big elevator and put 10 people in it, they're gonna overlap and be crowded in a smaller elevator. It's that simple of a concept. The teeth just don't have room. Very rarely do you see jaws where there's spaces in between teeth. Kids should actually have spaces in between all their teeth. So if you're a parent and your kid doesn't have spaces, they're already set up to have crowding and all these issues down the line. And there's things that could be done early on in life as soon as we start thinking about them. But yeah.
I'm curious. So if you are someone who, growing up, allergies, it's allergy season. It's this, it's that, cats, dogs, dander, 100% I've had those conversations. I'm going to a family friend's house, dander, dust, I'm sneezing. It's cats. And at that point, I never thought about it growing up, but since we've been having our conversations, mouth breathing, it's been a trend. Yeah. So that affects the development, people with smaller jaws because of that? Like it's recessed, or is that just a coincidence?
Yeah, no, it's important because when you mouth breathe and the tongue is very important for development of the jaws too. So for adequate development of jaws, not only is chewing and suckling and all these stimulation things important to get the muscles working on the jaws to grow them, the tongue is the most important expander of the jaws. But for that to happen properly, the tongue should have a proper seal against the roof of the mouth. I should be putting pressure against the roof of the mouth. Always. And we're not supposed to be speaking so much. We talk a lot, right? In modern society, we all got podcasts. We're all talking too much, right? We got phones. We were too busy back in the day
GPT.
Worrying about eating.
Yeah.
And nowadays, we don't have to worry about eating. We're talking all the time. We got too many opinions. But to that point, our tongue, our lips most of the day should be sealed. The tongue has to be up at the roof of the mouth, and we should be breathing through our nose. If you're breathing through your nose, your tongue is doing that.
Okay. Your tongue is doing that.
Yeah, your tongue is up against the roof of the mouth if you have good nasal breathing, right? If your mouth is open and you're breathing, your tongue is lower, it's not pushing up on the jaw and not putting that pressure for it to grow and expand. So that preventing good growth is an issue. And then also what happens is as you let your mouth open and drop, other things happen too. The teeth, because they're not hitting together, start to over erupt. They super erupt. They try to meet the other teeth. So if your mouth is open, even as adult, if your mouth is open as adult, for days, those teeth will start to drift down and meet. And then it elongates the face and it pushes that chin backwards because everything is going down and back.
Wow.
Another thing that happens too is that there's a pressure gradient change. If you're breathing through your mouth, what happens is the mouth pretty much turns into a nose just from pressure changes. So it becomes narrow. It becomes narrow and it becomes long. So people get high arched palates, long, narrow faces. When I was in school, medical school, they used to call it an adenoid face because doctors noticed that kids that needed their tonsils and adenoids out, they couldn't breathe well. They developed these long recessed faces.
Really?
Yeah.
Wow. Okay. And the solution is fix the jaw.
Yeah, definitely. Yeah, fix the jaw because that helps with breathing. All these, if you have a long face, recessed jaw, there's no way you can breathe well. And then what happens too is nobody can breathe through their nose because what you may not realize is that the inside of the nose sits on the upper jaw, right? So if the upper jaw is narrow and recessed, the turbinates and septums, the inside of the nose, if you look at anatomy, the inside of the nose is all squished.
That's why I sleep with a breathe right strip.
Yeah. And it probably helps you breathe through your nose.
It helps.
Right?
I know I get in bed after a long day. I'm like, now I got to get up and put one on.
It's important. There are things like that you can do to help sleep and adjust for the anatomical problems.
What a great movement. But you're also someone who's able to revolutionize this whole surgery.
Yeah, that's a good point.
So someone who can do it in an eighth of the time?
Yeah.
Arguably an eighth of the time.
Right.
Someone who has led the drive, led the how do I say, like the standard.
Yeah.
You said it's not just for airway, of course, improving the airway. Of course, it could be even a cosmetic look, but it's also for health in general. So for 100%. You, how does that tie in? How is all health tie into just the way you breathe?
Yeah, you brought up some really good points there in that question. I'm going to start with the timing of it because when I learned how to do this, it's a 6 to 8 hour operation and people are wired shut and it wasn't predictable. It's not stable. So I would talk people out of surgery, and everybody that's familiar with that surgery will talk people out of that surgery, which is why it's not a mainstream option even today. It was something that I really enjoyed as a surgeon because when we did it for the most severe cases. And even despite the tough recoveries, long operations, unpredictable results, there was such a transformation. But it wasn't something that, 90% of people could use this, but you wouldn't recommend this for 90% of the population because it was a long, difficult procedure, put people out of work for a long time. Keeping an open mind, and I have this thing where I still do it today, 13 years. Every case I do, every patient I see, I ask myself, why do we do what we do? How can we do it better? What can we learn from this? And it's an exercise I've done since I've operated. And every time I ask that question, I think about, what did I learn? A lot of people don't realize this unless they went to medical school or residency, is that in medicine, there's so much tradition and there's so many difficult concepts and skills to learn that for those two reasons, things are taught and passed down and taught and passed down. And because just to be competent at some level, you have to learn those things before you can ask those questions. And what happens is that in medicine, things are passed down for hundreds of years without change. And most of the time, people don't even ask if it makes sense or not, what's happening, especially in surgery.
It's just like in business. Hey, why do you do what you do? Oh, this is what we've done for a while. This is the way
we've done it.
This is the way we've done it.
Exactly.
And it's the most dangerous thing to do in business.
It's a terrible thing to, yeah, exactly right. So in surgery, unfortunately, that's true, but it's complex. There's a lot of reasons why that is the way it is. But I always had that questioning, like, why am I doing this? Does it make sense? How can I do it better? I don't want to be in the operating room for 8 hours. I don't like seeing the patients wired shut or, in a lot of pain or discomfort and then having unpredictable results. So over 13 years of practice and asking that, I've gotten this surgery down now to a 1 hour operation.
That's awesome.
And being open to technology and helping design the protocols using 3D custom titanium prints, now I'm able to do this operation not only efficiently, and if anyone that comes in the operating room and sees it, they always surprised to say, wow, it doesn't look like you're rushing at all. It's just efficient, and that's what it is. It's efficient, and on top of that, it's way more predictable, way more stable. We can plan everything. There's no real guesswork, and the outcomes are better. So it's a completely different operation now, where it used to be something that was 8 hours, wired shut, out of work for 4 to 6 weeks, in the hospital for 2 to 3, 4 nights. Now, on average, it's 23 hours, pretty much an outpatient surgery. Nobody's wired shut. You don't even need braces to do it. Traditionally, you had to have braces. Now you can do it with Invisalign or even retainers. And people are back to work in a week. 1 to 2 weeks. With a much more predictable, manageable recovery. So now it's something that it just opens the door as something that I would recommend to 90% of the population, because now we have a solution and you can ask those questions. This was the other thing you were saying is, how important is this breathing situation? And breathing is number one function. Like if you were to take a priority in life, before eating, before sleeping, before all those things are obviously very, very important. But if you were to make a list, top 10 most important functions, sleep, golf, exercise, watching TV, you know what I'm talking about.
Right.
Everything, right? Breathing is number one. More important than eating, more important than sleeping. That's like a second to second necessity. So that affects everything, oxygenation in our body, how all our organs get fuel, how all the cells work, all stems from breathing. And then breathing ties directly into sleep. Sleep is up there with food as maybe number 2 or 3 most important functions, because nobody can go a week, for example, without sleep and survive, right? Sleep is so pivotal. I mean, you have one night without good sleep and you're wrecked.
Oh, you feel it.
Right? You feel it. You're foggy, you're anxious, you're irritable. Those are obvious effects that happen right away. But imagine every day that your quality of sleep is not good. And if you're not breathing well, your quality of sleep is not good. So you think about all these people, 90% of people that have small jaws are walking around, none of them are getting optimal sleep, right? So people are not functioning well. Now, this is a really interesting thing for you as a business expert, because, and I noticed this with my brother. He works in my office. He helps. He's an executive in the business. And, Johnny will tell you this, 3:00 every day, he would shut down, like brain fog, end of the day, he can't function anymore. It was like, don't ask me any questions.
Talk to me tomorrow.
Yeah, talk to me tomorrow. And he had the surgery 3-4 months ago. Ever since surgery, he's the last person in the office. Everybody's done, and the guy's pounding work, and he can go all day.
Wow. So, one of the conversations we have is outwork, out-strategize, out-improve, outlast. Yeah. Just go to AOS.
Go to AOS. Yeah, if you're a CEO, I know you got a lot of CEOs watching you. If you're a CEO and you want the most out of your workforce, get them to breathe better.
We're going to get a subscription deal.
Exactly.
Really, so I can't wait to see him. I know I saw him right after.
Yeah.
And he was still eating.
He wasn't chewing yet.
Yeah, getting back into it.
Yeah.
I'm excited for that. But you just mentioned something here. You said 13 years practicing surgery?
Yep.
At what point did you bring the 8-hour surgery down to hour and a half?
So it was about year 6 or 7.
So at year 6 or 7, are there other people that are able to do this? Is this just you?
Yeah. So year 6 or 7, I discovered a technology that we can print titanium guides and plates. And it was being used for other types of procedures in the skeleton. And I figured I did it for a really extreme case. And I thought, man, I don't want to make an incision through the neck on this young lady and I don't want to do this long operation. I want it to be predictable. Let me try to design something with that technology to do a jaw surgery case, and did it, and it worked amazingly well. That was a difficult, very severe case, and she's on our podcast. If you look at a podcast, she was patient number 0. I can't remember which episode it was, but it was Lexi. And that operation would have been a 12-hour operation, and cut it down to 4, and the results were amazing. And ever since then, I knew that technology would work well. And I started evolving the designs and having more experience with it, and cut, around 6-7 years ago, cut the surgery from, I had gotten it probably from 8 to 4 hours at that time in my career, just from experience. And then I got it down from 4 to about 2 with the technology, and then learning how to really optimize that technology. Probably around 4 years ago, I got it down to an hour. And now we're under an hour on average.
Wow.
Yeah.
Go ahead.
You asked about other people using it. Nobody has done as many custom cases as I have, because I started the movement. But, I would say in the last year, there's been a huge adoption of surgeons using the custom workflow, but it's a large learning curve for it. So I don't think anyone's there yet at an hour or sub-hour or close. I think there are a handful of people that can get under 2 hours. Sometimes, not all the time. But I do think that in the future, we're going to be able to train people to do it the way I do it.
That's incredible. Not only is it, you're able to do so many more procedures on your end.
Right.
They feel better. They're more confident. They get back to their lives. You said in a quarter, a fraction of the time,
Correct.
Eating, chewing, having conversations back at the workforce.
Yeah.
But also, if you're leading the charge, like you're mentioning here, and you built this customization, you got it down to an hour, less than an hour on average. What do you want the industry to know? What's happening right now? What are we building? What's this movement that we're creating?
Yeah, it's a great question. This is the part that maybe if you can help me simplify this message out there, because I think the biggest thing is this. One is that anyone that knows anything about this surgery. So if you were to go to a doctor, and a doctor, thinks that, oh, you may need this surgery. Let's say it's an orthodontist who does braces, right? They won't even recommend it, because what they know is their experience with this surgery is the traditional way. They know what they've been exposed to with all other surgeons doing this for so long, is that it sucks, right? So they won't recommend it. And then that goes for the people that even know anything about it. So what happens is, because it was a difficult operation and people can't do it the way I'm doing it now, the mainstream has zero awareness of its potential and how actually accessible and, I would say, easy relatively it is, and how valuable this can be. So right now there's a challenge that, I may be one of 1 or 1 of 5 at the most that can offer these things. So unless you're watching the Alfi Podcast, watching Instagram, know someone that went through this, or has a doctor that knows about it, because we've been educating and giving lectures, you're probably not going to be aware that this is an option. So that's one, is getting the message out there and having patients talk about it.
Do people not know it's an option because someone's holding the narrative? Like, we could talk about big pharma, we could talk about medicine. I don't know if that's the direction. Maybe I'm just bringing this up.
Yeah.
But is that the direction you're going, or?
No, I think the reality is that, because I think that 90% of these people will benefit from this operation. But if right now there's a handful of people in the entire world that can offer it, people don't know about it.
Fair.
Right? That's changing. We're training people. I've trained surgeons over the last 5 years who are able to do these surgeries. There are other surgeons who are doing it, maybe not as fast as me, but I think that the amount of people that are experiencing this technology and learning the protocols will be able to offer it. But I think the message that, hey, this surgery, can be done in an hour. People can go back to work in a week. They don't have to be wired shut. The results are going to be great. That alone, compared to what anyone knows about it, is stay away from jaw surgery. That's number one. The other thing that's really important is, you're right, in medicine, and this is one of the biggest missions for us, and I do see a lot of steam in this globally, or at least lately in the biohacking community and other doctors that are becoming famous on social media, is that let's look at holistic approach, function, and root cause. Because in medicine, and I went through an amazing medical school, the reality is medicine is treating symptoms, right? You have high blood pressure, here's a pill.
Right.
You have anxiety, take this. You have depression, take this. Everything is just really old. Just look at those examples on their own, right? We're just treating a symptom. Mm-hmm. You're not fixing the blood pressure. You're just giving a medicine to bring it down. You're not fixing the anxiety. You're just giving a medicine to bring it down. And that's medicine in a nutshell here. It is big pharma, right? There's a pill for every problem, but none of them is actually helping people, and pills have side effects. But more importantly, they're not really getting to the root cause of what's making people ill.
It's a Band-Aid.
Right. Yeah, it's a Band-Aid. And, if you can accept that if you can accept that we don't have room for our wisdom teeth, and your teeth are crowded because the jaws are small, and this is new for humans and the big history of our jaws are smaller. If you're going to just accept that, which I think nobody will disagree with this, I don't think that anyone can refute that is fact. So just by accepting that, you can accept that the jaws are small. There's a problem for airway space, for breathing, for 90% of the people. And then just ask the question, would it be crazy to think that that's going to affect breathing and sleep? And I think it's very common sense to accept that people have breathing and sleep problem because the jaws are small. Then you ask yourself, how many people actually have breathing and sleep problems, right? Everybody. Who sleeps well? I don't know. I know very few people that say, I hit the bed, I sleep 8 hours, I never snore, I wake up, I don't need an alarm, I jump out of bed. It's just not true, right? People snore, and then as you get older, that gets worse. And these same people, they get into their 40s, 50s, 60s. How many of these 40, 50, 60-year-olds are not taking medicine? Very, very few. Most people are on a bunch of medicine.
Right. So, small jaw, problem breathing.
Yeah.
Problem breathing, fatigue, sleep.
Yeah.
Affects all different areas of life. Mm-hmm. So we're here to solve it.
We're here to solve it. Exactly. That's the mission, is get the word out, let people know we're doing it, and then educate surgeons and try to scale this thing to actually help people live a better life.
AOS worldwide.
That's right. Awesome. Yeah, here we are. South Florida, Miami,
Florida.
Yeah.
So for us here at this current phase, what is the next level? Right now, the impact we've created so far,
right,
is what we understand, that we're training people or sharing the stories of that. Hey, there's this new opportunity out there.
Right.
There's this new. Here's the cause and effect. Here's what we can do. It's less invasive. It's the recovery time is this. This is what it looks like. It's more of a palatable, pun intended,
right,
conversation.
Yeah.
Something where you can entertain, or it's something that you would want to consider because it's not as strenuous from what you're explaining. But what does this movement look like at the next phase?
Yeah, I think you're right. I think it's way beyond surgery itself. I think surgery for us is important because we have a solution to help people that have tried other things or have not had the chance to develop well. But it's the focus on breathing and sleep altogether. You're using nasal strips, for example, for sleeping at night, and that's great, right? It's
from you.
It's helped you sleep better, breathe better.
100%.
But how many people is that even on their radar, right?
Not many.
Yeah. How did you get that on your radar?
2 people.
Yeah.
Alex Hormozi and you.
Awesome. So our relationship, right?
Only because I've seen his videos.
Yep.
But you told me the science behind it, why it works. And then I saw his videos. I was like, wait a minute, but he wears it every day. Okay, I'm going to try it. Yeah. Now it's on an Amazon subscription.
Yeah, exactly. So, it's even just educating people like, one, hey, sleep is so important. We all know that charging our phones is a necessity every night. Do you ever go to sleep without charging your phone?
And if I do, I have 2 battery packs on me at all times ready to go.
Right?
Yeah.
There you go. Like, we're so in tune with like making sure our computers are charged, our phones are charged, but it's secondary to think that our brain computer needs to charge. Right? So one is like, hey, we need to charge, and we're not charging, and there's a lot of reasons for that. The second is like, how do you charge? You know, you can charge with one of those cables that are broken and kind of, you got to fidget them a little bit. You ever have those?
All the time.
Right.
And you're corner it so it doesn't in a perfect angle. You set it down.
Yeah,
you let it sit. 5 hours later, it hasn't charged.
Right. Exactly. So it's like, that's the exact analogy to sleep, because if your airway is not optimal, your charging cable is basically one of those cables you got to fidget, and that's exactly what happens with people. They start obstructing, so they have to move. They clench their teeth. They're doing all these things to work with that, fidgeting that cable to breathe. And at the end of the night, they're only 60% charged because it wasn't charging the whole time. That was a good analogy, actually. I never made that one before.
Hey, it's something everybody has a phone. Everybody has a phone. We can all relate. So you mentioned something I want to circle back to. You mentioned a few minutes ago about, having this opportunity.
Yeah.
How'd you say it? It was reminding myself what I do, why we do it for each and every case, bringing that back up. How'd you say it?
Yeah. The mamba mentality.
The mamba mentality, but it's also, the reason why we stand for what we stand for, the mission behind. And someone like you, 13 years operating, we're opening many different facilities, we're growing the brand, 100% being the center of influence here. Industry knows about your name, knows about the brand we're building, and it's only getting stronger because of what we're about to be a part of on Monday. Yeah. I don't know if I want to share the news here just yet. Maybe we'll ease into it. But having the opportunity to be the leader in this charge, what leadership, who trains the trainer? Who's in your ear? How do you keep driving day in and day out? And you said, it's a perfect mindset going into it. It doesn't feel like work. I know that part. Right. But for someone who is, maybe they're a surgeon watching this podcast. Yeah. Maybe there's someone who's trying to figure out, man, that would be great. I want to get to that level. It's inspiring to hear this. I've revolutionized surgery and this concept, and I want to do this, but do I have the mental, is it mental toughness? Is it drive? Maybe it's just being very clear as to what I want to build and why it matters to me. Yeah. How would you answer that?
Yeah, I think it's a great question. Because it's a great question because it applies to everybody and everything they do, right? And I think that everybody has a desire to succeed, in life. But unfortunately, few people reach their success or their potential. I think I love the mamba mentality. I know I preach it a lot, but
what does mamba mentality mean to you?
Yeah, to be the best version of yourself every day. Right. And that really means growing and learning, putting the ego aside, and, you miss a shot, that's a shot. You go back and take your other shot. You win, that's a win. You go back and the next day, right? There's so many good messages about like really continuing to learn. Past success doesn't mean future success. Past failure doesn't mean future failure or success. You really got to take every day at a time and make it the best you can and continue to grow. And I think Kobe had that message, delivered that message very well. So people like Kobe, PBD, these people that embody this, continuing to push and be moral and do well, I think that it's almost like it has to become the mindset, because it's not something that you can have one day and not the other. It really has to become part of who you are to want that, right? And I know you understand this well because you're surrounded by it. Right. Right. You're around winners and hardworking people.
Every conversation, we're challenging each other.
Right.
We're challenging perspective, mindset. If you're the leader of the vision, leader of the drive, leader of the mission, people's lives are dependent on you. Right. You can't have a downplay. You can't have a down moment.
Yeah, you got to show up.
Leaders, you have to show up. Yeah. Leaders, the reason they're winning at the highest level, they're able to push that reset button faster and faster and faster, not show the emotion. Leader of the household, arguably, they can't go home and have those conversations. I have to put that face on, give it 100%, turn those engines back on and give it 100% no matter what time of day it is. Yeah. So, I asked this question because it's like you said, it applies to all different areas of life,
right.
Business, drive,
family.
Yeah. And, what many people would say is, hey, if you have the conversation, you're working so hard, hustling, you're in the phase of life of building. Mm-hmm. You got to the point where we figured it out, all the hard work of 13 years, it's behind us. We got to this point. Mm-hmm. But to keep driving, building, scaling, we're not done.
Never done. Yeah.
You look at the winners who win at the highest level, Elon Musk's, or the people who run large operations, they're solving a bigger problem. And that's a conversation we have a lot on the back end.
Yeah.
But, we're just getting started. We're still getting warmed up here. But many people, they either lose sight of it or they're not as focused. So I asked you that question to see how you navigate those thoughts and
actions. I think it's that appreciation is that, everything in the past, really it's in the past. Like today's today, and you can't rest on that. Whether it was failure or success, and you got to move forward. You know this better than anybody. I love talking to you because you're always challenging me. Right? It
wouldn't be a good conversation.
You have this mentality, but that helps, right? And I want that because we don't want to be stagnant. In life, nobody can ever, there's no such thing as staying stagnant. You're either going forward or behind, right? So if you're not going forward, you're going behind.
If you're not going forward, you're being left behind.
Or being left behind.
That sounds worse.
It does sound worse. You're right. So you got to keep pushing. You got to keep going forward. For doctors, I think that was the earlier part of your question. Surgeons up and coming, what do they do? I think it's having that mentality that one doesn't stop when you're out of school and you got your degree, right? That's in your past. You got to continue. I've learned so much more every day than I did in the past, right? I've grown so much more as a surgeon after I finished my training than I did before my training. So one of them is having that mentality that it doesn't stop. You got to keep being the best version of yourself and looking out. And I lost my train of thought for the second part.
Yeah, no, it's just the drive. You're talking about the drive here.
The drive, the open mind.
The open-mindedness.
That's the one.
Okay.
Yeah, put open mind that, I ask myself this every day. Am I doing the best I can do? Can I do it better? But I think a lot of people get stuck with their egos that I'm doing the best I can. That I am the best, right?
There it is.
But if you have that, if you're the best, you're not going to grow and you're not going to change. I feel like for me, and every time I give a lecture, I say, when I come back next year, I'm going to show you something new because to a point, I want to make sure that I continue to evolve.
Yeah. So here comes my question. I'll challenge you here.
Yeah.
David Alfi of today is able to meet, shake hands, sit down. He's having a podcast with David Alfi of 10 years ago, 3 years after you started.
Right.
We can give the surface level advice, right? What is the advice that David Alfi of today would give David Alfi 10 years ago? But go deep with this, not surface level. Maybe you could go deep on it, as far as mindset, what that means, but I don't want to put words in your mouth. What would you say? What does that conversation sound like?
It's a great question. I feel like my mindset, that mamba mentality was there, but I don't think that I really appreciated how much I needed to challenge the status quo. I think early on, especially when I finished training, and I think this happens to a lot of people that go through any professional training, you give so much credibility and respect to what you were taught, I think to a fault.
What does that mean?
I think that there's so much flawed, not in a bad, I don't mean this in a disrespectful way. I just mean in a way that, time will show that things will get better, right? And I think when you learn something, especially when you learn something complex and you become an expert, in surgery, especially a surgery like oral maxillofacial surgery, there's not that many people at this level that can do this niche operation. So you come out and you are an expert just by training, right? And it's hard to really appreciate how little the specialty even knows. And I know that now, what I knew 10 years ago, I'll tell myself, like, everything you learn, it's great, it's foundation, but you're like 10% of knowledge and philosophy that you will be 10 years from now. And I do think that that's true even today. I think that 10 years from now, I will look back at everything I know and think now and think that I was only at 10% the level, for example, that I will be at 10 years from now. But I think that's a huge message.
That's amazing. But let's take that concept, 10% level you knew back then to compare to what now. And it's great you're learning, right? That's only the standard. But what does that do for you knowing, shoot, what does the next 10 years do? Like what can that look like? What's going on in your head when you think about that?
That for me is so exciting, because just to think of that leap from 10 years ago to now, and I love 10X, right? In business, we always like 10X. We want to 10X everything.
Of course. We want to get there faster.
Right. We want to get there faster. And it's true with knowledge and thought process and experience and philosophy and all that. So to me, the fact that I've learned so much, have changed so many, revolutionized so many things in the last 10 years, knowing that the next 10 years can have even a greater leap is very exciting. Otherwise, it would be very boring. To know that I would get to the finish line now would be depressing.
Wow, that's such a good,
right.
Good. I share this too. I want to let you keep going, but I want to interrupt. One of my biggest fears, and I've shared on a recent video, is knowing that there could be a possibility that Antonio never reaches full potential.
Yeah.
And I'm, doing whatever it takes. It's mindset, it's family, it's motivation, it's
mamba
drive, mamba mentality to keep on keeping on.
Yeah.
Or there's a book, or there's a saying, it takes what it takes.
Yeah.
Or you can go even deeper and say, the job's not done.
Yeah.
And we're always driving, always being challenged. And I give all my credit, all my thanks out there, of course, to Patrick Bet-David, the influence, the thought, the leadership, the hustle. It's inspired by him.
Yeah.
I'll see him.
He's an amazing mentor.
Oh.
I think about my mentors. He's definitely one of them. He's an amazing mentor, and you have a direct relationship.
Yeah. But I'll share this concept. I want to go back to you here. Many entrepreneurs or want to be entrepreneurs, or many people that are in the workforce get that job. And once they rise that standard, this is the status quo.
Yeah. You
can operate your job. You've made it. Maybe there's growth. Okay, here's a new standard operating procedure. This is this new challenge. Maybe here's a new quote, and you get to this point, but we're slowly increasing year over year. But when you work for a founder, you work for a startup, you work for someone that's from the ground level. When I started, there was only 9 of us at Valuetainment, and Bet-David Consulting. Now there's over 150 of us across all divisions, and it's 3 years later. But what I share is, once I go through onboarding, I got to this level. Next day, this level. And it's like slowly climbing the staircase. But Patrick he wants to take over America.
Yeah.
He wants to help influence and share the right media, share the right consulting, talk to entrepreneurs, leaders around the world, share the right impact, and just be that thought leader, because it means the most to him and his family.
Right.
When he shares, guys, I'm not even supposed to win. I'm not even from here. But it matters to me, and that's why I want to do this.
Yeah.
So back to the idea of knowing what the possibility could look like, man, I want all of it.
Right.
But it's incredible to know that that's exactly what goes through your mind, and that's the direction you're going.
Yeah. Yeah. It is amazing. And it is amazing to know that there are a community of people like that, right? You're surrounded by it.
It's one of the most attractive languages to speak, is the challenge to process.
Yep.
One of the most rewarding conversations, whether the conversation leads to more down the road, or I just end up talking to an entrepreneur, I just disturb them.
Yeah.
And I'll ask them this question. I'll say, hey, Bob, who mentors the mentor? Who coaches the coach?
Right.
Who sits back and trains the trainer? And, after day-to-day operations, day in and day out, Monday through Friday, maybe Saturday if you're building it from ground zero, maybe incorporating a podcast or team activities. When does the leader of the vision take a moment just to take a step back, just to work on himself or work on the leaders in the company? Right. And I mean a step back, not as in less of a workflow or less of a drive, but hey, there's 30 minutes where I'm just thinking.
Yeah.
No computers, no distractions, phone, just for mindset, because hey, I can do it. But if I can only do it, that's selfish.
Right.
If we can do it, that's where the vision comes from.
Yeah, definitely. Yeah, that's such a good point for business. This is great. Transition. Let's transition to you for a little bit.
Okay.
Because I think this will be, having you here and you have such an amazing knowledge base for leadership and business and skills. I know you've read, how many books have you read in the last year?
I just moved apartments and I had boxes just full of books.
Right.
Now, if I would have asked myself 10 years ago,
yeah.
there would be no boxes of books.
Right.
I could probably count maybe just less than a few hundred.
Yeah.
And it's been incredible because growing up, I didn't read. I didn't like reading.
Mm-hmm.
I was taught for the wrong reasons. I want to get out there, play sports,
Yep.
use my hands. And if I read a book, it took me a year to read it. I just never wanted to do it. But that quickly changed because I knew there's something else out there for me.
Yeah, now you can't get enough.
Now I have multiple books that are on the shelf but I haven't even read yet. That's my unread section.
Right.
That sounds so weird.
Yeah. So let's give some pearls to the audience while you're here, because we have a really amazing audience. These are people, actually the people that are listening to this podcast are people that are part of the 90%. You know, they may have trouble breathing or sleeping and have signs and symptoms that 90% of people have: jaw pain, headaches, shoulder pain, and they're searching for answers. But those same people, because that's everybody, are also the ones that are open-minded enough to say that, hey, let's not depend on pills and, you know, what we know is to be the standard of medicine and healthcare, and let's have an open mind and try to learn and see what these experts who are thinking out of the box are saying and thinking. So by essence, my audience is a Mamba mentality audience, right? Because they're searching for more.
They want answers.
They want answers, and they're open-minded to know that there are answers out there, or questions out there, right? So it is the Mamba mentality. So to that point, they're going to appreciate some real value pearls. So I know you've read how many books. We've talked about so many of them. Let's start with, you know, for the surgeons out there, the people out, the patients out there, just in public, your favorite top 3 books on personal growth and leadership?
I just created a video about this actually.
Did you?
And I know where we're gonna transition. I love where we're going. 3 books in particular. I would say one of them is Who Not How. It's more for business. This is more of a business drive mindset for development. You know, how can I do this?
Mm-hmm.
Or it's who can help me do this? One is just me, one is we. Me, we. But having the conversation, once I read that book, I wanted 25 assistants. Yeah. I wanted someone to help me out in different areas. But it goes to show, hey, let's share the pressure.
Yeah.
Let's have, if we're going to build a business, we're going to build this vision. You know, it's so much more out there than just you. Yeah. You're building a leader, building a vision. Rich Dad, Poor Dad. That was one of
my favorite books too.
Pivotal moments in my life. When I read that book, everything changed.
Mm-hmm. It's an excellent book.
Sold my car.
I recommend that to everybody.
Yes, everything. But it just gave you a perspective.
Yeah.
One of the biggest credits I can give back to my mentors is I just want perspective.
Yeah.
I don't want one way. I want you to give me both options.
Mm-hmm.
Let me make the decision. So for me, Rich Dad, Poor Dad, I got to hear how he operates and the stepfather operates. Yeah. And it was quick enough for me to understand this is the way I want to go. Mm-hmm. And if that's the way, why are you relying on somebody else? That was the mindset for it. And then, of course, Your Next 5 Moves, Patrick Bet-David.
It's a great book.
And always having the carrot in front of you. Like right now, I already know exactly, I have 5 moves in front of me. As soon as I get down to move number 4, 2-3 moves, they're already spinning up. Mm-hmm. I'm already trying to figure out where I'm going. And I'm also making sure at each and every moment, if a decision comes in front of me, right now at this exact moment, I know it's right for me or I know it's not because I'm clear on where the vision is. And I get all that credit from Patrick Bet-David, right? I know I keep mentioning his name here, but if you're clear on the vision, you're not going to compromise speed and you're not going to compromise that vision. You're only going to do what it takes to get to that point. Yep. So for this audience, having that conversation, knowing, hey, if there's a concern, there's a drive, there's an opportunity out there, how much longer am I going to wait to take advantage? Or how much longer am I going to wait to see if this works? Or hey, if there's an opportunity, maybe it's a perspective, who is in my ear? Who's having these conversations? Who's the late night conversation? Your appointment before bed, what's in your ear? That's a long tangent for my 3 books, but those would be the biggest help.
Yeah, those are great. Yeah, I didn't read your first one, but I read your last 2.
I don't know if it's a book for you right now, but I'll bring it back up later.
Yeah, all right. Biggest mistake that people do?
Biggest mistake? They don't build their leaders. they're far too dependent on themselves.
Yeah.
I built my business. This is my baby. This is everything I know. You know, if I'm talking to myself 10 years ago, oh man, I had the biggest, wildest dreams. I'm going to take over the world in this area. 10 years later, you're still doing the exact same thing. You have a team. The business is growing. You're doubling, tripling revenue, but you have the exact same job title.
Yeah.
And I say job title, you're not a business owner because you're very much in the business.
Mm-hmm.
Because you haven't trained or developed or given your leaders that much credit. Why? Are you afraid?
Yeah.
Is it unclear? Is it, hey, I'm the only one who can do what I do? Interesting.
Yeah, that's
if
ego,
you're the
right?
only one who can do what I do, why don't you develop the ones around you?
Right.
For example, I tell my CEOs, hey, do you have your team in person? Are they on the field or where are they? If they're in person,
Mm-hmm.
whenever you're traveling, if you're going down the elevator, if you're walking in the office, grab one of your guys, talk to them. They'll appreciate all of 15 seconds you have with them.
Mm-hmm.
They'll appreciate all of 10 minutes you can spend with them, maybe a lunch every other week or every other month, depending on how many employees. But developing your leaders, that's far too uncommon for businesses who are trying to figure it out. Now, people who establish great companies and growing companies, they know that it makes sense and you have to develop your leaders. You can do great in your field, but who else can do that?
Yeah, absolutely.
And you're building, you're growing. That's such an important pivotal moment because someone who's genuine, you've built them, you've shown them the world, the opportunity, change their lives, man, they're going to be your fan for life.
Yeah.
They're going to help you grow that business. And the last answer I'll give is who goes to bed at night thinking about business just as much as you?
Mm-hmm.
At that point, you can spread your leadership apart all different areas and allow the business to run like a machine.
Right.
That's the biggest mistake.
Yeah, that's good. And I think one of the things I continue to learn, and it's very comforting to know too, that value is everything, right? No matter what business you're in, to be successful, you have to continue to provide value, right? And morally, that's an amazing message.
Yeah, and 100%. There's two ways. Is it, hey, I need that reminder? We talk about it all the time internally. We have a monthly all hands meeting, monthly staff meeting,
Mm-hmm.
where the whole company, all 150 of us get together. Why?
Yeah.
We recruit our people.
Yeah.
Whether it's mindset, whether it's vision, whether it's drive, whether it's, hey, listen, we have a book of the month in front of us. We're actually reading the book Principles.
Mm-hmm.
Such an incredible book for just the little stories, nuggets of information you can get, mindset, perspective. But it's the moment where you can reinvent, re-recruit, re-remind that, hey, listen, this is what we're doing. Now, it's easy for people watching this video to say, oh, man, I like this. This has fired me up. Or you're like, man, what are they talking about?
Mm-hmm.
Are you at that level? Do you want to be at that level? Not everybody plays at the level we want to play at.
Yep.
But if you want to get to that point, you're gonna love this conversation. So I agree. Everybody appreciates value.
Let's go. This is fun. You've met a lot of interesting people through your environment. Who's a favorite celebrity or non-celebrity that you've met?
That I've met.
Top three. Let's go top three. Three is fun.
Okay. Top three that I've met. Robert Kiyosaki. We were just talking about him.
Yep.
I got to shake hands. I had all of 35 seconds with him.
Mm-hmm.
But I was able to have a conversation and just thank him. And
Yep.
sit there and, the mindset he instilled in me, he gave me perspective. I
Yep.
think if there's any pivotal moment of perspective, I think he really sparked it. The
Mm-hmm.
rocket took off when he told me about perspective or reading his book. I would say it would be Robert. If I could put number 2 on that, you're really going to make me think here. Trump's on that list. I haven't met him yet, but
Yep.
Trump, I mean, you could see even his mugshot in the White House,
Mm-hmm.
right? That's a mindset.
Yep.
A lot of people say, why does it even matter? Yeah, look what they did with him. Look what he's doing. He doesn't have to do anything of what he's doing.
It's a statement too.
It's a statement.
Right.
And, he just cares, love, trust, respect. And, any opinion you have on that, that's fine. But
Right.
look at what he's done. Look at the impact he's making. I would put him on the list. I don't know out of order for one of 3. Another one I would give is, just being around someone like Patrick.
Yeah.
100% is Patrick.
Yeah.
That's a given, but I'm just going to put him on
Right.
the list. I'll share why. Business value, mindset, great.
Mm-hmm.
Family.
Yeah.
Family. I want to be the best father. I want to be the best CEO. How is that possible?
Mm-hmm.
Is it possible? We have the conversation. If you want to be a part of the Valuetainment dream, vision, brand, work-life balance, that's not an option.
Right.
And I might lose so many people saying this right here.
I say that all the time.
But there's no opportunity for you to 100% build the biggest empire you want
Mm-hmm.
and have the best relationship with the kids.
Yep.
Now, it's not like you put them to the side and you forget about them. You
No.
can. There's a conversation of integration. One of the biggest things about Patrick, Jennifer Bet David, she's in the office every
Yeah.
day.
Yeah.
I'm there, she's there.
Yeah, I think integration is a key word for that.
It's, operate at that high level. It's vision, clarity, mindset.
Yep.
Not only is Jennifer in the office, but the kids.
The kids are
the
there.
kids are running
and
around.
They've experienced everything.
They've experienced everything. And Patrick shares this. He says, guys, we're going to build a company and a vision so big that my kids, no matter what they want to do, they'll be able to work for me.
Yep.
Lawyer, construct, anything they want. I'm going to build a vision so big that they can grow within mine. And that's what I love. Before my time with Patrick, I was an entrepreneur myself.
Yep.
But he shared the opportunity for me knowing anything you want to do, it's possible. Share the idea. If it brings the billion, we're going to drive it. My vision can fully grow inside of his, and that's so rewarding.
Yeah, that's awesome. I got a good one for you. Where's Antonio 5 years from now?
Where's Antonio 5 years from now? I'm driving Bet David Consulting. We're operating at multiple different offices. We're not just in Florida. We're growing a sales team, a consulting division, well over 1,000 consultants. Very much impacting the world, the masses. We have eyeballs that watch the PBD podcast. We have eyeballs that buy our merch. We have people who are invigorated about the mission. The future looks bright. The slogan, hey, no matter where you are at life, what phase of life you're in, the future looks bright.
Right.
And for us to be a part of that mission, that drive, consulting, having conversations with entrepreneurs around the world, to come to one of our events. We have an event in September, over 12,000 entrepreneurs worldwide,
it's amazing.
Over 100 countries.
Yeah.
That's invigorating.
Yeah.
But that's such a small number. That's such a small number. So
it really is, actually.
Myself, 5 years from now, well-established, driving the business, a whole different consulting division, multiple different locations, and we're impacting the masses. That's from a business standpoint.
Yeah. That's awesome. If you can, this is going to be a difficult one.
We'll see.
All right. Give me a 10, 20, 30-second pitch. Help me out. How do I deliver the message? There's an epidemic in shrinking jaw sizes. And how do we get that message across? We have a solution to do it. How do we make this mainstream?
That's such an easy question.
Okay.
It's not easy. It's simple, but I'll share the direction.
Yep.
I'll share the direction. I'm being funny by saying that. How does anything become mainstream? Is it the idea? Is it the concept? Is it the person behind it? Is it the team? Is it the story? Is it just something that's fitting? It's a new fad. It's something new that everybody sparks. There's interest. Oh, really? Let's try this.
Right.
And, it's more of a
trend,
a trending topic, a trending word. And, it's something like new industry trends. And all of a sudden, 3 months from now, hey, you guys remember about that option?
Right.
Yeah, I forgot about it. But I would break it down into a couple of things. It's the person who's driving the vision, or the person who's driving the concept. You take Elon Musk. Maybe I don't agree with everything that he's doing or done. I love the guy. I'll buy a Tesla just because of him. And that's my personal views. Many people might not think that, but I love his vision, his drive, his relentless pursuit. Have you read his book, Elon Musk?
I haven't yet. No.
It's a big book, but let me tell you, you have hard work and you have Elon Musk. Sleeping on the factory floor, doesn't have a house. He's driven by just helping and providing and, taking his...
He's all in.
He's all in. And, we'll ask the question, how does someone run an average, ordinary business, and does someone run an industry-leading concept? They solve a bigger problem. Yep. Let's go back to your question here.
There you go.
Let's go back to your question. How do you make this mainstream? How do you build it? There's a direction. There's an opportunity to be 100% truthful and reliable and dependent and sharing the right vision. And maybe people don't see it now, but they're going to think back in 10 years from now and say, man, he was always right. He was always right. People might be winning now in the business field, and there's many people where they have a great global audience, or they have events, they have live events and things like that, but they're being exposed.
Right.
Why? Because maybe the vision, the values aren't there. I shared one thing at the beginning. I shared Patrick will never compromise the vision, and he'll never compromise speed. So any decision, even I told you that I'll make, is always aligned with my family first, where I want to go, and who I'm going to be impacting myself. Okay, put that aside. I know exactly what direction I'm going. I can say yes or no, but that's the decision I make in what I do, my area of business here. So for yourself is sharing the message, continually sharing the message, having other people challenge their mindset. like you see like Tucker Carlson, you see someone like Patrick or big thought leaders where they're just challenging your perspective. Mm-hmm. Sometimes they're calloused, right? They're calloused for what they know. Who's in their ear? Interesting. So who's watching this podcast? Interesting. Who's in their ear? Why are they in that ear? Okay, well maybe they need help. Maybe they're in a shadow of doubt, or maybe they're just trying to figure it out and they don't know who to trust, which is probably 90%, or maybe it's less. You'll be able to know. I'm just making this up here, but who do I trust? How do I know where to go? And being able to have those conversations in multiple different ways. There's many people who love just talks. There's many people who want to be sat down and say, really, this is how it can affect me. It's almost like life planning. It's almost like physically planning or investment planning. How do I know it's going to work for me? Sure, you've done this before, but how is it going to work for me? So to directly answer your question, sharing what you know, why you do what you do, why it fires you up, because we're going to be attracted to who you are. Mm-hmm. First they hear you, then they see you, then they follow the dream, the vision. They say, you know what, I'm attached. I might not be ready, or I might not be a client, or I might not be someone who is ready yet, but man, that guy knows what he's talking about. Right. And it slowly builds that brand, that recognition. One of the biggest concepts I learned when I was a part of incubators and accelerators was build in public. And it was the concept of, hey, day one, I'm building a website. Day two, we're getting the IP. Day three, we're doing this, and we're going to build this brand. I know it's going to be a couple of years, but I'm going to tell you what I'm doing. I'm building my audience. We have to build that audience. We have to build that army. Patrick shares, guys, we're going to build an army of entrepreneurs, industry leaders so big around the world. Watch them try to create a policy that goes against us. Watch them try to take us down. They're going to have to go through all of us over here. Why? Because who do you trust, the government, or do you trust business owners? And I don't want to go into politics if we don't need to, but it's the same concept.
Yeah, absolutely.
Building the dream, building the vision. That's what I would say. Yeah, building the brand.
Absolutely. I agree. And this is interesting because I've heard Patrick say this, and you brought this message up several times in this podcast alone, is solving a bigger problem. Successful businesses, successful missions, the more successful they are, the bigger the problem they're solving. And I can say that there is no bigger problem than this one. Breathing is number one, and it's epidemic. So I think that's going to continue to drive this.
Huge. Well, David, it's been great. I know you're out here. We'll share it. We'll share while you're here.
May I? Go for it. Yeah.
So Monday, we're going to go behind the scenes of the PBD podcast. Not only to see and open up the hood as to the number one podcast for entrepreneurs, business leaders around the world, but we're also going to see how we function. Yep. What is our team dynamic? What is every single step of the way, how a perfect podcast comes to be. Not only that, sitting down with Patrick, David, building the flywheel, having all different areas of your business be put together. So I'm very excited. I'm not going to give you any more details, but Monday is going to be a great experience.
Very much looking forward to it. I can't wait to take all that knowledge, contribute it to this podcast, and drive this message home. Before we end this, greatest basketball player of all time.
Greatest basketball player of all time. It has to be Kobe Bryant.
All right.
David, I appreciate it. Thanks for allowing me to be on. I know we're not in Texas. I know one day I'll be able to jump on the pod and have Kobe in the background.
Kobe in the background, definitely.
Awesome.
Thank you.
Appreciate you.
All right.
All right.